Leukemia is a cancer that starts in blood-forming tissues such as the bone marrow and causes large numbers of blood cells to be produced and enter the bloodstream. We interviewed Matthew Gilbert, who's a leukemia survivor, and has graciously shared his story with us. How did you find out you had leukemia?
I was in the Air Force, and I worked on nuclear bombs, and they thought I was having heart attacks at a young age. Within 62 days later, my liver shut down, and had to give a urine sample. And they stuck me in a secluded room. They cleaned out all these people, went into a waiting room, cleaned everybody out, and so wasn't sure what was going on. I thought maybe I had a cold or whatever. And so we went in, and my wife was with me, and I had this secluded, nice room, peaceful. Went to the bathroom, and I come out and had to have my hand in my shorts because I was bleeding and would stop. I peed blood for an hour and a half. So very embarrassed, which I don't get embarrassed, but very embarrassing for anybody else. Standing there with my hand in my shorts while they're putting an IV in my left arm to plug me full of platelets because I couldn't stop bleeding from peeing. He's like, "What are you doing?" I'm like, "It's not good. We just need to fix it."
What type of leukemia did they
I
have?
had ALL, an acute lymphoblastic leukemia, and that is what little kids usually get. It's 100% curable in kids. There's a 1% chance you'll live in an adult. But they say it's a little kid's disease, and I guess I'm still a kid at heart. That's why I got it.
What type of treatment did you start?
When I was first diagnosed, they put me on, we discussed bone marrow transplant, and I'd been in the Cancer Institute at St. Luke's Hospital. And when you go into the treatment room, it's a big room opened up, and they've got tons of chairs with curtains. Well, most time when you go sit down, you sit there visiting with other patients, and you become a big family, basically.
Yeah.
You learn all the ins and outs of a transplant, and I decided from the second day I wasn't doing a transplant because everybody I seen go through a transplant, 90% of them died. And I watched how sick they got and how miserable they were. And I told my wife, I said, "You know what, I don't plan on me being like that because I'm going to live and I'm going to enjoy life."
Matthew initially chose to take chemotherapy for treatment, but later had to receive a bone marrow transplant.
I did the chemo. They hit you as hard as they can with chemo to stop it.
Right.
Once they get into a certain point of remission, then they have to do a bone marrow transplant. And once they do the radiation, they kill your body. They kill every cell in your body. After radiation, a lot of people don't know, I lost all my toenails, my fingernails, all my eyelashes, all the hair on my body. I lost all the skin on my tongue, the skin on my throat. I had these long sticks with sponges on them, and we'd have to take it to swallow my throat out because all that skin would come up out of my throat, and I couldn't breathe. And we couldn't figure out what all that stuff was and lose everything. Lose everything.
Wow.
Yeah. And if you're a man or a boy, your male part turns black because of the radiation. I had a PCT come in. He's a friend of mine. He's a black kid, and he'd always come in and rub me all with lotion because you dry out real bad. And if you don't put lotion on, you just crack. And he come in one day, and I told him, I said, "Leland, don't you touch me again." He said, "How come?" And I just pulled the sheet back, and I said, "You're rubbing off on me." I said, "I told you to leave that thing alone." Going through all the stuff you go through is such a downer for most people.
Yeah.
I have such great humor and a lot of fun. If I can't make a joke out of it, ain't worth doing. My opinion is everything happens for a reason. I'm a firm believer in God, and I think that He gives you what you can handle. I think, and I always heard, He does things to build character. I keep telling him He can start with some mess. I got enough character. We're done. I was a professional bull rider for 13 years, and I had pretty good sum of money, I guess you would say. So we paid some after coming out of the military, and then the hospital wrote a lot of it off because once you exceed a couple million, it's like, who cares? Yeah. You can squeeze a turnip, but you ain't gonna get blood out of it. So squeeze all you want to because you're not gonna get it. I used to have debit creditors, or whatever you call them, would call and say, "Okay, you have to pay us." I'm like, "Okay, what would you like me to give you? I've got 3 kids, pick one of them. If I pay you, they're not going to get to eat. So you just take one of them and you feed them and you can deal with it." We can't do it. I said, exactly. You understand where I'm coming from? We can't either.
Yeah.
But I asked him, I said, my nephew has chickenpox. Do I need to worry about it? And he says, well, didn't you have chickenpox as a kid? And I said, I did. He said, nah, you can't get it again. Well, far from the truth, I can. After a transplant, you have to get all your baby shots again. So you have to get all these sicknesses. You can get them all again.
Yeah.
When you go through a transplant, you have no immune system. It's very hard to go anywhere because if she has, one of you guys have a cold or just a cough, that cough could be some slight little bitty type of infection that my body couldn't handle. And if I get it, I could end up in the hospital immediately. There's been times that I got sick. My kids wanted chickens and ducks one year for Easter. So I went, and I was pretty ornery. I'd go to Feldman's and get them. And when they died, take them back, get a refund, get a new one. Well, I didn't know that chickens are about the nastiest things in the world because they walk in all their feces.
Yeah.
Okay, I ended up in ICU because I was all the bird flu infections that they had.
Yeah.
And I got real sick, real fast. You know, when you have, after having a bone marrow transplant, you can't eat nothing without being cooked immediately, and it has to be eaten immediately. I wore gloves all the time, just because for germs. I had a pair of leather gloves, and I went everywhere. Because, see, I love to fish. And during transplant, after transplant, they told me I couldn't fish because the slime on the side of the fish is bacterial.
Yeah.
And your body can't adjust to it. It can kill you, make you real sick. So I wore gloves. Boy.
Matthew's entire life changed, not only because he couldn't bull ride, but he couldn't be out in the world where he wanted to be. Matthew was prescribed steroids during his treatment. Now, 8 years later, he suffers many side effects. His bones are deteriorating, which require replacement surgeries.
Your belly right here. Yeah.
So, what effects? Like, you just had surgery on your foot, you had your hip.
I had my hip 5 years ago, double knees last April.
And those were all side effects of the steroids?
Of the steroids. Yeah, because the steroids, when I was on steroids, I usually weighed about 145 to 150 pounds. On steroids, I weighed 320.
So what's an average day for you like now?
Well, it's not pain-free, that's for sure. An average day, well now that I'm working here at this wonderful place, it's pretty easy.
Yeah.
I come up here and I just find something I need to get done, I get it done. I try not to I can't get on my knees. So if I have to work on something on the floor, I have to sit on my butt and slide around. Nothing, I don't really care. I don't get too excited about too many things. Because it's going to happen one way or the other.
Yeah.
You know, whether you like it or not, you just got to do it, figure out how you're going to deal with it, and go for it. Whatever makes it work best for you is the way you do it.
Leukemia, the most common blood cancer, includes several diseases. The four major types are acute lymphocytic leukemia, also known as acute lymphoblastic leukemia, or ALL, chronic lymphocytic leukemia, CLL, acute myelogenous leukemia, AML, and chronic myelogenous leukemia, CML. Although affecting approximately 10 times more adults than children, leukemia is the most common cancer among children, with ALL accounting for approximately 75% of all childhood leukemias.
They assured me that it wasn't cancer. It was probably hepatitis or, some kind of sickness or whatever. Maybe I caught a cold. It was really hitting my immune system.